Hi friends, this is Dr. Shweta. Presently, I am pursuing my DM dermatology. Today's video, I will be making about a very interesting topic which you always encounter now and then. And the topic is why do doctors have such a bad handwriting? You will always find people who are saying that doctors have such a bad handwriting. So, as a doctor myself, who himself is having very bad handwriting, I have tried to figure out the causes for which I am having bad handwriting, or as such, a doctor community is having bad handwriting. So starting with the first part, well, basically what we see as a handwriting is the prescription part only. What happens ki in the residency, whether you are doing PG or in MS, MD or DM, you have to do a lot of paperwork. This involves a lot of writing, history taking, then writing investigation sheets, filling the treatment sheet, and then if a patient dies, then filling the death forms and certificates. Even a single death form or certificate takes almost 5 to 6 pages to fill. The problem is that maximum of them are just for the purpose of the formality. So we are in a hurry that so that we can do as quickly as possible, because it is anyways going for now only documentation purpose, and maximum will have only the documentation purpose only. So at that time we are in a hurry that we have to fill it as fast as possible. Similarly, in the case of the history taking or in the case of the investigation sheet filling, it is like do it as quickly as possible so that we can do other clinical steps. So this I find the most important cause for which doctors have bad handwriting, because all doctors have to undergo the rigorous residency program of 3 years. Then if they are doing super specialization, then there is a program again 3 years. So the whole process become very tedious, and hence we in general tend to ignore the handwriting. Second important part is that the examination of the MBBS, which is professional examination, or MD or MS examination, they ask very long descriptive answers. So in order to, so it is like we have to fill almost 30 to 32 pages in a span of 3 hours. So the practice comes from there, that so that we can write fast and in the exams. Third and the most important part is that it seems to tend that doctors are having bad handwriting because we don't see handwriting of other people of other professions. Like you can't remember which other professions handwriting you are regularly coming day to day basis. Almost all the things of the handwriting are all almost typed, and we have to just sign. And if it is written, then it's generally for the personal handmade notes or personal notes which a person makes. So since we come across doctor's handwritings every now and then. Hence, we tend to get the feeling that doctor's handwriting is bad. Uh, I I am pretty sure that if you take handwriting of all the peoples among different professions, then you will find that the handwriting is similar in all professions. I mean, maximum people are having similar type of percentage. You will find many people will having bad handwritings, few will be having good handwritings, etc. Second, in general, also you will see that handwriting, generally girls have better handwriting than boys, and this holds good in the medical profession also. I have seen many girls who are having a very good handwriting. In general, boys can also have good handwriting, but generally girls are have more good handwriting than the boys. Now coming to the next part, what happens is that after doing practice for 5 to 10 years, the disease which you are coming across are very common. Like every medicine practitioner sees daily 15 cases of hypertension or diabetes mellitus or myalgia, etc. So the drugs which are used to be written are generally common. It's just like that the drug is in your head, and you have to just jot it down so that you can see the next patient. So in the theory, what happens that our handwriting gradually becomes more and more worse, because we never tend to give a special this to handwriting. So our brain is such that okay, we have to write the drugs. This is like injection pantoprazole. So okay, it's my brain, and I will write it as fast as possible so that I can see the next patients. This is also one of the reason. And then the other reason which I found is that generally the practice of a doctor is not that much dependent on the handwriting. It is like a doctor is writing the drug, and it will be given by the pharmacist. A pharmacist is able to understand, and doctor is able to write. So doctor thinks that okay, it's even it's not bad handwriting. How does it really matter? Now few people will argue that it does matter, it does matter, and sometimes bad medicine, sometimes wrong medicines are being given. But this cases happen less frequently in general. I mean, this can happen, a doctor has to be good handwriting, but generally doctor think that this I am writing and the medicine store will be, or the pharmacist will be able to read, so what is the need to improve it? Many people have this belief that doctors write bad handwriting so that only the particular pharmacist can read it. I think it is wrong. I am pretty sure that bad handwriting is not due to the fact that doctor is getting some commission, and so he will write only that drug and that particular pharmacist will understand. The reason is simple. I mean, a patient can take the prescription to any pharmacist. Secondly, once a drug is being bought, then the next time there is no need of prescription. The patient can simply take the wrapper of the drug and take the medicine. So at least in this case, regarding handwriting, there is no such contribution between doctor and pharmacist relationship, etc. Now, so overall we can say that doctor handwriting is bad because a doctor thinks, first, due to the rigorous course in which he have to write thousands of pages, and most importantly that according to doctor, the maximum doctor thinks that this is hardly going to affect his career as such. I am not of the favor that doctor should have bad handwriting. He should have good handwriting, or at least legible handwriting. And so many doctors use total capital letters in writing the prescriptions. At various places now it has been now typed prescription paper is also available. So these are my views regarding the handwriting. I hope you find it useful and interesting. Thank you.